So many times when we have patients come into the office, we find that they are in fact flossing every day, but not very effectively. So one of the best ways to find out how it's going is to actually have a patient demonstrate. Stephanie's going to show us how she's flossing at home, and we'll see if it's working. Okay, let's practice a different way. Let's practice a different way, because I can see that you're giving it a good try, but I think you have too many fingers in the back of your mouth. So the first thing I would like to show you is a different kind of floss. And this is a woven floss. It's fuzzy, so it kind of acts like an abrasive when you use it, and you tear off about 18 inches. I think I have a little too much here, but it's about 18 inches. Then you wrap it around your middle fingers. And when you do that, you can have tension on the floss. Maybe give yourself about 4 to 5 inches between your fingers, and then use your thumb and your index finger to guide it, so that you're only putting that much in your mouth, not all 4 fingers. Does that make some sense? So this is what it would feel like. You can get all the way back, and then as I push down, I'm going to push against the back tooth, and then I'm going to pull it forward and go against the front tooth. So every time you go between the teeth, you're actually cleaning 2 surfaces. And if I were to do it in the front, I would make a C with the floss so that it goes down under that little flap of tissue between your teeth, then come up to where the teeth meet. Let's see if we can get my finger around there, and go down the other side. Get that? So you're actually cleaning 2 surfaces, and you're making a C and wrapping it. You want to try it?
Sure.
Middle fingers. Good. About 4 to 5 inches in between, and a thumb and an index finger, or 2 thumbs and 2 index fingers, whichever works best for you. Try to go all the way back. That looks better. Don't you feel like you have more control now?
Mm-hmm.
Great, much better. And you're making the C with the floss, so that lets it slip down under the tissue. Okay. Now if you swap out and do it this way, in this direction, then you'll be able to, there you go. Can you get all the way to the back of your mouth with it? Great. That looks a lot better.
Much better.
We're going to review how we hold the floss again, and we'll demonstrate this time on a dentiform so that we can see a little bit better. So we want to tear off again about 18 inches of floss, wrap it around our middle fingers, leave 4 to 5 inches between our middle fingers, and use our thumb and index finger to guide the floss. Either 2 index fingers, 2 thumbs, or 1 of each, whatever is best for you and which is most comfortable. And then when we use the floss, we're going to seesaw it through the contact, and once we get through, then we're going to make a C, let it slip down under that little flap of tissue, rub up and down, and then we'll do the same thing on the adjacent side, right, rubbing it up and down. And we just do that all the way around. This fuzzy floss actually helps to grab the plaque. Now, an area of the mouth that we didn't talk about when we were demonstrating in the patient is the back of the very last tooth. And because there's no adjacent tooth, we kind of have to loop it around the back like we're shining a shoe, and just gently seesaw it back and forth for a little bit and let it slip down under that tissue to clean out. We can do it on the top teeth as well. And usually just the 2 fingers is enough to guide it all the way to the back of the mouth. If you try to get 4 fingers back there, you'll never make it.